Hey, Dr. Prathap here. At the risk of being redundant, stale, or boring, here's another video aimed at helping you out health-wise throughout this pandemic. My last video covered what to do to help you stay out of pain. But what if you already had some issues going into the lockdown? What if you were seeking treatment for an injury, but due to governmental recommendations, your healthcare provider is unavailable? I can tell you that from our end, at Atlas Chiropractic and Wellness, we're doing whatever we can to get back to work so we can get back to getting you on track. Our US colleagues have just been deemed essential, so many of them are back to work with obvious safety and sanitary precautions in place. It's a difficult decision, but we are going to remain closed for the near future to keep both our frontline staff and our patient community safe, preventing the risk of transmission from our clinics. We have been discussing the idea of taking emergency cases only, and again, we will update you once we're accepting these cases. The cases we usually get at Atlas are primarily musculoskeletal, in other words, cases relating to the muscles, joints, spine, and often nerves of the body. Keep in mind, this is a broad area of concern, so the advice I'm about to give you is going to be super general and not to be taken as a diagnosis. To further help you to this end, we are actively looking for a suitable platform to host virtual consultations. But until that option comes to fruition, use this guide as a basic set of recommendations to help you out. We want to avoid going to an already overcrowded hospital where chances of picking up an infection are higher. My rules are basically starting with don't panic. Panic will send alarm bells all through your body and may even cause your body to feel more pain. Remain calm, sort through the process, and see if you can apply any of the tips we're listing out here. And if none of these help, go ahead to phone an agent for telehealth. Practo is a great option here. Again, the goal is to avoid a trip to the hospital. Number 2, determining the type of pain. Okay, pain can have all sorts of origins and causes. These ideas can help you not panic and sort through the symptoms. For starters, try and determine if your pain is focused on one spot or if it starts somewhere and travels somewhere else. For example, a pain that starts in the neck and then travels down the arm into the wrist. If this scenario or something like it sounds familiar, there might be pressure on a nerve, which could require some further testing. Don't worry though, most of this type of pain is reversible. Most other types of pain we see are posture induced. So another quick fix is to quickly review your activities and change anything repetitive in nature. Number 3, are you hydrated? Being taken out of your routine usually means more than your work suffers. This can sometimes mean your normal self-care routine takes a hit as well. Like it was mentioned in the previous video, staying hydrated is important for muscle health as well as immune function. Our muscles by volume store tons of water and cease to function well without it, leading to cramping and tightness. The coronavirus, as you are well aware, is a respiratory illness that affects the lungs, and one of the major ways into your lungs is obviously through your mouth. By regularly sipping water, you lessen the chance of the virus entering your respiratory tract, and you get to stay hydrated. Score the win-win by drinking 2 to 3 liters per day. Number 4 is a doozy. Should I use ice or heat? So I get this question a lot, and in fact, it's a debate that continues even in expert circles. The science behind it has basically shown ice to not be useful therapeutically. However, and people might disagree with me on this, but in acute injury, 24 to 48 hours after the injury, it is useful for someone to use ice to reduce the pain and avoid a hospital visit or a painkiller. The old RICE method, which stands for rest, ice, compression, and elevation, was used to treat acute injury, but this has also been debunked and widely discredited. Rest is useful within 48 hours after injury. Ice we've talked about. Compression is not to be used while sleeping, and elevation can be useful in cases of swelling. However, the way this method used to be employed, sometimes up to 2 weeks of nothing but this, left people with injuries that didn't heal very well. Modern science has shown that basic movements, light stretching, and general mobility and range of motion exercises are safe to try earlier than often prescribed by healthcare practitioners. As rehab guru Craig Liebenson is known to say, do the hardest thing you can do well often. Heat is useful for reducing pain and stiffness in tight muscles. Think about water. When you put water into the freezer, it tightens up into ice. And when you heat it up, it loosens into steam. If you woke up with a stiff neck after a Candy Crush marathon, there's a good chance your muscles are tight and heat can help. Whether you choose to use heat or ice, perhaps one works better for you than the other, adhere to the guideline of 10 to 20 minutes per session and a max of 2 to 3 times a day. If you're using a hot water bottle, make sure that the plug is securely in. Also, especially with heat, try not to lie down or sit on the source. The hot water bag can burst, but worse, you can develop burns or desensitize tiny nerves that run on the surface of your skin. Avoid rubbing ointments and balms in combination with heat because you can lead to chemical burns as well. Follow the knee, move, all those things are fine. Just try not to use them in conjunction with heat. Number 5, stretch. Sound familiar? The same thing that can prevent pain can rescue from pain. At this point, everybody should be including some stretching in their day-to-day activities. Especially if you've been consulting with a professional for your condition and they've prescribed exercises, do them for God's sake. If you've forgotten them, see if your provider offers online or telehealth options to help you. If you have any sort of issues, check their online resources. Beware of the thousands of self-help options out there. But if it looks familiar, proceed with caution. We've been building our database on exercise videos on YouTube, so check back on our channel often for updates. We're adding more on a week-to-week basis. Number 6, use your best judgment. As we mentioned earlier, visiting a hospital at this juncture in the progression of COVID-19 is a risky bet, both for other patients, the frontline staff, and yourself. If you've injured yourself during the lockdown, like, I don't know, if you've slipped and fell, how would you know if your ankle is broken? Immediate swelling and an inability to move the area could indicate a possible fracture. Realize that rushing out and getting an x-ray immediately may not result in anything visible on the film, so try your best to manage the pain on your own. Small injuries can be managed with over-the-counter medication and with other tips that we've already talked about. If the pain is worse than you've ever felt or it's severely limiting your daily function, please consult a professional, whether with telehealth or online. Another way your best judgment can come to your aid is rationale. Does it feel like something you've had before? If it does, can you remember what you did to get through it last time? Were there any special instructions given? If so, definitely try to recollect that information and apply it as necessary. Again, the goal is not to sit and suffer, but to avoid unnecessary exposure to the coronavirus. Well, I really hope this helps. I realize that it's very general, but remember, take home, do not panic. We'll update our YouTube channel, so definitely try to have a look at that at home. The home exercises we're posting are safe to do at home, so that's the reason why I'm recommending them. Between then and now, do your best to stay home, but definitely stay safe.